Hello, my name is Ada Willis, and I'm here to talk to you today about hospice nursing. Now, hospice nursing is a very, very special part of community health nursing. It has to do with the dying process, and hospice nurses are very, very special because, it takes a special type person to be around this much death and, dying and stuff and be able to be supportive and kind and be there for them during the whole dying process. As floor nurses, I know me personally working in the SNF, I've encountered a lot of hospice nurses and I've collaborated with them for a lot of my patients. I mostly work with geriatrics, so there you go. Hospice can also be used for pediatric patients. I've never really worked with peds that much. Honestly, I think it would make me too sad to do pediatric hospice nursing, but there are nurses that do it, and they are awesome and superstars. Now, the primary activities of a hospice nurse are providing direct care of the patients, which has to do with assessing the patient, deciding, do they need to get an order for some more pain medication for them or something for anxiety like lorazepam. I've noticed that a lot of the hospice patients, at least at my facility, they've received sublingual Ativan and sublingual morphine as needed. Um, Hospice nurses provide psychosocial support to their patients, which is, supporting them on their journey from life into death. And, they do support the families a lot too, because I know I'm not a hospice nurse, but when I had a patient that was actively in hospice, I would call the family and update them. And the hospice nurse was actually grateful that I called a patient's family member because they were able to be there, um, which ties into ensuring that the patients don't die alone. Um, the hospice nurses will a lot of times alert the family, like, hey, it's time to come, because, you don't want to miss it if a loved one is dying. You want to be there for them as much as you can. The hospice nurse helps continually improve the quality of patient care to make sure we're providing the best care that we can for our loved one. Um, they also provide emotional, spiritual support to their patients. A lot of times they'll get a chaplain if the patient's religious. Sometimes, people get really religious too towards the end of life. And they're also there for the patients, just like we're there for the patients, even, those of us that aren't hospice nurses. Scope of practice. The contemporary meaning of hospice refers to palliative care of the very ill and dying, reducing distress from physical, emotional, and spiritual symptoms. The scope of practice for hospice we already pretty much covered. Hospice is a really, really great group, a great nursing community. Hospice nurses are wonderful. I love working with them. Teaching and learning strategies. The primary goal for hospice is to help maintain the client's dignity and comfort. The teaching strategies would be to teach the family about communicating with each other about essential sensitive issues related to death and dying, like would they want to be buried, would they want to be cremated, where would they like their ashes scattered, what kind of service they would have. Some people, that might live in Jacksonville and they might want to be buried in like Maryland or Kentucky or somewhere by the house that they grew up in. And we also can teach the family to perform non-pharmacological interventions to lessen the dying's pain. Um, Therapeutic touch is always good, and repositioning too with pillows to make them nice and comfortable. Educational preparation required for hospice. Um, an ADN degree and RN licensure is usually preferred, and of course, everyone always likes the bachelor's. I do know a lot of LPNs that work in hospice, so I'm pretty sure that LPNs can work in hospice as well. And a master's in science and nursing is recommended for further advancement. And of course, if you want to work in hospice, you'd need your hospice and palliative care nursing certification. And a little more education will never go amiss. Okay, other disciplines or professionals involved. Volunteers, chaplain support, respite care for the family, because it can be very, very time consuming trying to care for someone in the dying process. It's certainly a full-time job. um, there are groups to assist with financial help with medications. If someone, say somebody quit their job so they could be home with their loved one during, their last few weeks or months, there's financial help out there. There's hospice doctors that help prescribe the pain medication and the medication that will keep them comfortable. There are hospice CNAs and home health aides that will help, clean a patient and reposition them, do mouth care, and, help spruce them up a little bit. And there's also bereavement counseling, which would be, of course, after death, when you start to get really sad. Okay. Necessary skills and abilities. Healthcare providers who work with dying patients often experience unique stress. It would be very stressful to watch a patient go through the dying process. I've personally felt really sad when I've seen some of my patients pass, so I could only imagine. There's coping mechanisms and self-care are definitely important, like going to get your nails done. I like to go to the gym. That's my coping mechanism. Um, Reading, and you gotta have a firm foundation in home care skills. Because a lot of the hospice nursing, you will be at home, so you probably would want to have a lot of good experience with that to be a hospice nurse. Okay, necessary skills and abilities continued. The ability to comfort with the death and dying. You have to have the ability to meet personal emotional needs as well as emotional needs of the hospice client and the family. You need to remember to be there for yourself as well for your patients and their families. As nurses, I know it's very hard to put yourself first, but sometimes, you gotta take some you time or you'll get compassion fatigue. I know you all know what I'm talking about. You have to have a knowledge of community resources to be a good hospice nurse. There is community hospice, as we talked about, and getting them in touch with like Access Florida, for food and stuff if they need to have some more food in the household because a loved one has quit their job or not working as much in order to take care of their loved one as they pass. What is so great about hospice? Now, that is a completely satire statement. Hospice is amazing, as we've already discussed. One of my favorite quotes is Mahatma Gandhi said, "The best way to find yourself is to lose yourself in the service of others." And I have found that in my experience to be 100% true. There is nothing better than being able to help others. Hospice nursing is tough, but loving and kind care makes all the difference. Patients can really tell, if you love what you do, and they can tell, who's there for the money and who's there because this is their calling and this is what they love to do. For me, like I said, I'm not a hospice nurse, but I love taking care of patients. And that is it with my presentation on hospice nursing. Here are my references. Let me move this up a little bit so you can see them better. All right. All right. Thank you.